Hi everybody, it's Adrienne here again, and today in this short video, we're just going to take a little bit of a closer look at that developmental trajectory that we started talking about in our last video. So if you think back, as you remember in that last video, we were talking about some of those things that we know when we look at the research and when we look at the evidence of what do we know about brain development and how can we use this to help us advocate for our kids, for ourselves, and then also how can we use that to know how to make better decisions if our children are having behavioral, learning, or socialization challenges, and just how can we connect in a more efficient way and parent in a way that's really coming from this brain-based understanding. So when we talked about the things that we knew in the last video, we really looked at the fact that the brain is really not fully developed at birth, and we know that there's this trajectory or this way in which the brain moves through development. And as we get more and more sophisticated through development, we gain more of those sophisticated tools. So those tools, of course, dictate our behavior. The tools we have are what gives us the ability to engage, to connect, and to learn from our world, which gives us that observable behavior that we have. So behavior makes a lot of sense when we look at it from this brain-based perspective and understanding that we don't just have a bad kid or a bad person. What we have is a window into the brain and a window into how we're using our brain or how that child is using their brain, where they are, maybe what happened during brain development. We also know that stress of all different forms has been shown to have a negative impact on brain development and function. So we know it's not just stress, but it's actually a result of stress that can happen that might create these challenges or these changes inside of the autonomic nervous system. And that can cause us to be more in that fight or flight mode. So we know we have to address these things clinically sometimes in order to facilitate healthy brain development or function. So what we're going to do in this video is we're just going to take a few minutes to zoom in a little bit on that brain development in just a little bit of a deeper level than we did before. So that way we can have a full understanding of what we're talking about here and how can we use this understanding that we're going to gain to help us really see where a child or an adult is and what tools they're using, where they might be efficient or inefficient, and how can we help. So this is what we're going to call the first hierarchy of brain development. And we actually call it the watch and wonder hierarchy because we can see, so we see a lot of observable behaviors and we can see how an individual is engaging with their world. And that really tells us a lot. So if we just kind of take a step back, we watch and we wonder with a little bit of this knowledge, and it can help us a lot and help us to have a lot of self-discovery on what they're doing in there and why they're behaving the way that they are, why they're having challenges, or why they're connecting in the way that they are. So when we look at this brain development, this trajectory, we know that we start in our primitive brain, which, like we talked about, that's where we start when we're born and when we're in utero. It's the first area to develop in our brain, and that facilitates how we function. And it's really from the bottom of the brain at the brainstem. And this is where those things that we talked about in our last video, which we called infantile movement or primitive reflexes, really come from. So we're going to write this here on our whiteboard. And these are called infantile movement reflexes, or as I like to call them, primitive reflexes. So we have PR for our primitive reflexes. You might be able to see this fully, but that's okay because we just want to give you a little bit of a visual, a bigger picture of all of this. So these reflexes are the things like we talked about. When you do this, your baby turns their head. Well, that doesn't persist forever in life. You know, we don't go around turning our head because our finger touched our cheek. So as we get more sophisticated ways to find food, we don't need this help for us in order to find food. So you do this to the baby, they turn their head to find the nipple, and that's a reflex. That's from the brainstem. That's not a very sophisticated way, but as we move through development, just like we talked about in that last video, we do become more sophisticated in the tools that we use to engage and learn and connect with our world. So the next most primary tool that we use, or our next most sophisticated tool, is our movement touch systems. So this is where we begin to really become more coordinated and we're more efficient in our ability to move through space. So with that, we become more sophisticated in touching things, in moving, in learning, and engaging and connecting within our environment in this movement touch kind of way. So that's why as babies, they put everything in their mouth, right? There's a lot of tactile information that they're sending to their brain, and there's a lot of that stimulation that comes really from the mouth. So actually, sometimes if I'm taking a clinical history of someone and a parent tells me, hey, you know what, my baby didn't really move around a lot. They just sat. I would put them on the rug and they just sat there. They never really wanted to move. They didn't go anywhere. They were really calm and compliant, and they never put anything in their mouth. And I hear that, that's actually a little bit of a red flag for me, because I'm like, hey, I wonder why. This is a really typical thing and it's really important in that first year of life for the child to be moving and exploring the physicality and in a movement touch way, and using those opportunities to feed their brain appropriately. So when we're thinking of the brain, we can think of it as if like we're using bricks to build a house. So you have a layer of brick, and then the next layer goes on that level, and the next and the next. And we really need each level to facilitate just like development. So what it makes me wonder then is, if they didn't have this level, was there some sort of interference in the way that the brain responds to stress or in the brain development, and that was altering the way the brain was becoming more sophisticated? We have to really look at all of that and all of those different clinical pieces, which is really what we do. But that's one of the things that we look at, and that's just a little window. Kind of like if someone tells me that their child never crawled, or they didn't like tummy time, or they had trouble latching. These are all windows into their history, which is telling me and giving me these clinical clues to what their developmental history was like. And also, of course, what their brain development was like, and what their stress response was like. And most importantly, what their neurological state was like. So that would be was it facilitating typical or atypical brain development? So we move through infantile movement, reflexes, and then we move into movement touch. And then in that second year of life, we become really interested in auditory verbalization. So we're going to put that here on our board. This is where we become sophisticated in our ability to engage in our world through sound, through noises, by making sounds, by hearing sounds. We take that auditory input and then we have output. So this is where it starts with babies with cooing and babbling. And of course, as we've said before, doesn't mean that there's not these other areas that are still working. It just means that we're really emerging into this auditory verbal area. We're becoming really much more sophisticated in this way. And so that's really important. And then the final way that we become fully developed, so when we have that full brain development, is when we become something that we call visually competent. So visual cognition is a way that we can process our world. Now, this is important to have and to make this distinction. It's not that we're talking about visual acuity, not like, do I have the ability to see? Do I need glasses? Of course, those are important pieces of development, because that is one of the senses that comes in to feed the brain. But what we're really talking about here is, do I have the ability, when we are fully there, and this is around 4 to 6 years old, can I use my mind's eye to create imagery, to process my world in this visual way? So what I want to talk about here is, we understand and we all accept here that this is the way that we move through development, right? So we use these tools, and they're a window into the brain and how the brain is moving through development. And as we become more and more sophisticated through our tools, we put more of our processing in each of these baskets. And these tools with more sophistication then becomes the more sophisticated tools. And at the end, we land here at visual cognitive. So of course, that means we are using all of these senses to give us this visual cognitive skill, because we're able to integrate all of the senses of our world, and then we land here in this visual cognitive function. So all of these are really important pieces, and this is what happens when we become fully developed and efficient. So let's talk about now, what happens if we don't? So let's say, what if something has altered the way that the brain is receiving information and processing information? And we'll talk a little bit more about what that something could be in another video. We've already talked about it a little bit, but in the next video, we'll really dive into it a little bit more. And then we'll also talk more about what can we do about it? But for right now, we just want to talk about, what if something does interfere with the way that we've moved through this developmental trajectory? Um, so what if something has hindered us? So we're going to use our red marker here and we're going to put an X. Let's say there are some things here that have hindered us. So it's not always like a roadblock or a firm stop here. Um, so that means like could be something like a brain injury, but that's not what we're talking about here. We're talking about something that has hindered us from developing in the most efficient way and landing up here at this visual cognitive in this whole brain function, and therefore not being able to use the most efficient tools and all of the tools. So we might have some visual cognition here in this example, but let's say our primary tools are here in auditory verbal as well as movement touch. Okay, so these are the two realms that our tools are really living in. So for this example, let's say we have a 10-year-old boy, could be a girl, could be any age, but we're just going to use this example. We have a 10-year-old boy who, for some reason, has not and is not there. And this is really important. This is what we always say. He's not there yet. They're not there yet in full brain development because something has hindered or obstructed or interfered with the way that the brain is moving through development. But remember, we know that different stressors and our different ability to be resilient and to adapt to those stressors can create this autonomic imbalance, which then pushes us into that fight or flight mode. And that can impact the way that the brain is moving through development. So something has caused that to happen, and that's impacting the way that we continue to move through the development, and therefore the way that we're engaging with our world. So it's really important to remember that this individual is not there yet. Our primary tools here are still in the movement touch and the auditory realms. So if you think about that, that 10-year-old boy's behavior, like what do you think he's going to be behaving like? How is he going to engage and connect and interact within his world? So you're probably thinking about it. I'm going to answer it for you. He's probably going to be moving his body a lot. So here in movement touch, right? He would be a mover, a toucher. He's probably going to be pretty tactile. He might be touching himself, might be using his hands and constantly touching his hands, touching other things, touching other people. So in this example, maybe he would be hyperactive because he's moving so much. He might have some of that hyperactive behavior. He might need some touch or some inappropriate touching, especially when he's stressed, because when we get stressed, if we're here, we kind of move down and we become more deflected. So this is what we call deflected behaviors, maybe like a need to pull in and back up. So he might pick scabs. He might, pick at his shirt, suck on his shirt when he's at school. He might have the edge of his shirt and suck on that, chew on the pencil, any number of things. They can all come in different manifestations, but the primary way that he's processing his world is through moving and touching, right? So movement touch then gives us these behaviors. They're called deflections. So the behaviors we're talking about, maybe some hyperactivity, extra touching. And this is how he's processing his world through the way that his brain is moving through development. Now, maybe his primary tool is auditory verbal. So in this one, maybe we hum a lot or we click our tongue a lot. We make a lot of noises. So we're going to see this individual might actually be really sensitive to other noises because they need to control their environment so much that they don't want someone else to control it. So it's very stressful then if someone else comes in here and they create noises or they're in this auditory environment that they don't process well because they're taking this auditory input and they're really having a hard time turning it into pictures, so they can't predict well. So they don't want others to be the one to control the auditory input and the auditory environment. We might see some sensory defensiveness here or sensory integration challenges. So things like, I don't like tags on my shirt. I don't like socks on. I don't wear shoes. I only wear one pair of pants or one outfit because when you change my tactile environment, I now don't know how to control that because someone or something else is controlling it. Because I process my world by controlling that. So these are some really common manifestations. If we have some of these primitive reflexes that are still present, that can also change the trajectory of brain development. And sometimes we might see that we have a complete shutting down in stress, or like a complete zoning out, or shutting down for somebody who looks like a child that they're just not connecting, or they're not paying attention, particularly when they're in stress. You might see some memory issues. They're not retaining those things because really memory lives up here in this visual cognitive function. And if we're not there yet, you might have a hard time remembering some things. You might also see some difficulty with emotional regulation, so quick to react, any of those stressful challenges. And these are all windows into the brain. They're windows into what tools we're using, and windows into how that brain is moving through this developmental trajectory, which we have to understand. And then we get to be investigators, to start to know what to do to help them, not to cover up these things. These kids are not broken. These adults are not broken. They're just using their most efficient tools to process their world. It's not a cognitive choice. It's based on this deflected neurology. And the great thing is, at any point, at any age, the brain can change. We just have to be able to ask and answer the right clinical questions to be able to help. Okay, so let's also think about this. What is socialization, right? So, like we talked about before, socialization is really a visual dance. And if I'm not there yet, I might have some challenges connecting, engaging, making peer to peer relationships. And we hear this all the time. Oh, my kid's doing okay with that. They do really well with younger kids, and they do really well with adults. But peer to peer interactions, not so great. So there's a reason for that. Peer to peer, it really takes that visual dance. Whereas with younger kids, I get to control, and with older adults, they kind of tolerate it. So if I'm not picking up on the appropriate social cues, that's okay in the younger and the older, but peer to peer, not so much. And that is something that is a really big window into the brain. What about oppositional defiance? So in that case, I don't have any ability to control, or I don't have any ability to predict, because visualization, which is up here, that creates prediction. So I'm going to start to pull in, and I'm going to try to control my environment. And the more demand, or the more I need to process, then the more I'm going to pull in, and I'm going to try to control all of this. And that then invokes anxiety. So then we might see this OCD type tendencies, which is very, very common, and it can come in many different forms. So this is that need to control, kind of like creating like an OCD or a defiance. So I'm going to control my environment. And when that demand comes at me, I'm going to have a bigger demand to try to control. And that's a really big window into the brain. So it's our job not to cover, or to say that these kids or these adults are bad, but our job is to look at the evidence that's out there and to be able to determine how to put all of these pieces together, so we can know what's going on. We can ask the right clinical, educational, and parenting types of questions. And then from there, we can come up with a solution to start to really put those pieces together, and to help these individuals have better tools, have more efficient tools, and to get them here to this visual cognitive area. So when we move up in this hierarchy and we have these more efficient tools, then that need to deflect and the deflections kind of just start to go away. And that's our whole objective here. We want to move through so we can get the best, most efficient tools. So in our next video, we're going to talk a little bit more about those responses that can happen as a result of stress, the things that can impact this hierarchical development of the brain. And then we're also going to talk about what to do.